accounts for 91% of the national total, among which 111 in Wuhan, accounting for 97% of the province, and 3 cases from other cities, that is 2 from Huanggang and 1 in Jinmen, respectively. The other 14 cities did not report any confirmed cases in the last 24 hours. Currently, still in hospital, 25050, among which critical cases 5407, critical cases 1186, accounting for 26% combining. As of yesterday, the total number of deaths 2834. On March the 2nd, we have reported 31 new death cases, among which 24 in Wuhan. As of yesterday, the total number of discharged patients 36167, and the newly discharged is 2410, among which 1846 are in Wuhan. And we've seen a consistent increase of the discharged patient. Now let's give the floor to Mr. Yang Yan. Friends from the press, good afternoon. The treatment of COVID-19 is the priority of prevention control. The province have been attaching importance to the key points, that is treatment and prevention control. We have been prioritized the allocation of medical resources in frontline medical treatment, and we have currently curbed the transmission trend in the province, and we have made major progress in treatment. First, we are moving ahead the treatment process so as to address the mission problem, improve the test efficiency to test all the patient that needs to be tested. Once a confirmed case is reported, we have to make sure that this person is properly admitted in the medical institutions. In order to realize 100% admission and treatment, we've established temporary hospitals and strengthened the support in terms of medical resources and human resources. As of 24 o'clock of March the 20th, we have 238 designated hospitals, among which 25,000 are hospitalized and 2,400 are discharged on the day, and altogether the discharged patients amounts to 36,000, which is a mass increase in terms of recovery rate. Second, prioritize the treatment of critical and severe cases. Carry out collective treatment in order to reduce the number of deaths. Currently, the number of hospital beds to admit severe and critical cases can meet the demand. Through the building of ICUs, the beds number is increasing by a large margin. Now we have extra beds to spare. As of March the 2nd, the Guanggu Hospital and Union Hospital have opened up more than 7,200 beds, among which negative pressure beds amounts to 245. Altogether, they have treated more than 3,700 patients. The death rate in Wuhan city is decreasing steadily. Third, to prevent the mild cases from deteriorating and reduce the proportion of severe cases, carry out the much-needed treatment using the medical equipment such as ventilators, improve the capacity in temporary hospitals, and provide the medical staff with the necessary supplies as well as medicines. For the mild cases and general confirmed cases, we monitor their health conditions closely and carry out initial treatment and diagnosis, and make sure that TCM plays an important role in the treatment of mild cases. Currently, we are treating almost all the mild cases with TCMs, and which effectively reduce the severe cases proportion. Fourth, act according to the Central Party Committee's instructions in terms of categorized treatment and to prevent effectively the transmission of the disease. And we also have conduct this region-specific treatment and have categorized the regions in our province into low, mid, and high-risk regions. The medical institution play a key role in terms of the treatment, and online medical services are playing a bigger role in these efforts. Coming up, our priority in treatment are first to strengthen treatment of the severe cases so as to make sure that the high-caliber medical talents can play a bigger role in terms of medical inspection as well as a one-on-one individualized treatment plan. And we also increase the usage of ECMO in necessary conditions and strengthen the treatment of pre-existing conditions so as to reduce complications. Second, to strengthen treatment of mild cases, to conduct the 4 early mechanisms so as to move the treatment time period forward. Conduct timely intervention at an early stage of the disease so as to reduce the possibility of deterioration. Conduct a comprehensive nucleic acid test of all the quarantined people and use the important window of the reporting of the cases to the treatment of the cases. Implement necessary rotation and scientific shift mechanisms for the medical workers and arrange medical resources in a scientific and reasonable way and restore the pre-existing medical services in an orderly fashion. Now the floor is open to questions. Please identify yourself first. With Renmin.net, March the 1st, one of the earliest temporary hospital was closed. So does that mean that we have successfully kept the situation under control, and do we have a judgment as to the trend of the development of the COVID-19? The number of hospital beds was once the biggest impediment in terms of the goal to realize 100% admission. Under the leadership of the steering committee, we have made decision to renovate the designated hospitals and open up temporary hospitals to increase admission capacity in order to address these most difficult issues, which has been proven to be highly effective. Even in the epicenter, that is the city of Wuhan, we now have beds to spare. The Chaokou temporary hospital have been closed down, which is a clear example of the achievement we have made. But we have to understand clearly that we are still facing daunting tasks ahead of us, and we cannot relax for a moment and should not loosen our effort. there are factors that should be changed, and there are factors that should remain unchanged. The changes refer to the positive indicators that we're seeing: the reduction of confirmed cases, the reduction of suspected and mild cases, especially in the city of Wuhan. The newly confirmed cases has been reduced to 114 as of today. And the outbreak transmission has been curbed. Third is the number of close contact is increasing, which shows that our method of quarantine is taking effective. Fourth, the proportion of severe cases is decreasing, and the recovery rate is increasing, which shows the effectiveness of our treatment plan. 5, the resources are centered around the improvement of medical capacity. Second, our general situation is still very severe and complex, very complex. According to the deployment of the Central Party Committee and central government, will continue to take the most strict measures. Here are some of the problems we're facing. First, we still have a large number of existing cases, that is more than 20,000 patients province-wide, and more than 6,000 critical and severe cases. The incremental risk still exists. In the city of Wuhan, we still have more than 100 cases on a daily basis. 3, we're still facing uncertainties. There are some asymptomatic patients that shows a positive result, and some of the discharged patients also show positive results in terms of nucleic acid test. Fourth, in terms of some poorly instructed places and neighborhood, there are still weak links. Generally speaking, we still have a lot of battles to fight, and we must be fully prepared to face these challenges ahead of us. Hereby, my highest tribute goes to all of the medical workers that are still working in the front line. This is still our first priority at the current stage. We have to remain confident and pragmatic in terms of making deployment so as to win this battle in the end. With Economic Daily, according to the available numbers, the death rate in Hubei province and the proportion of severe cases are both decreasing. My question is, in terms of the treatment, what are the measures that have been taken, and what are the steps, next steps? Thank you for the question. With the guidance of the steering committee, we have been mobilized the medical resources of the country, the province, as well as the cities, to make sure that we have sufficient beds to treat the severe cases, and make sure that we have the much needed equipment as well as personnel to treat these cases. At the same time, we have to make conclusions and to conclude some of the most important experiences during the first stage of treatment. Through our efforts, we now see a turning point in terms of the number of severe cases that has been reduced to more than 11,000 to 6,500 as of yesterday. Here are some of the measures that we have taken in the last period of time. First is to mobilize medical resources, that is the 4 collective schemes, the collective for patients, experts, resources, as well as treatment. We make comprehensive and coordinated efforts and also mobilize the best medical workers to treat the severe cases and make conclusion of the experiences so as to carry out homogenic treatment to all of the severe cases. With the support of the best medical teams that is led by academician Zhong Nanshan, Li Lanjuan, Chao Qing, Tong Xuan, and other 10 very renowned medical professionals have arrived in Hubei province, and more than 330 medical teams with more than 40,000 medical workers rushed to our province to our rescue, among which many are experts in CCM, cardiovascular, anesthesia, and this total number of these personnel amounts to more than 15,000. They have taken over many wards in the designated hospitals. During treatment, they have played an essential role. Third is to conduct targeted treatment. We carry out inspection and resident consult, as well as the online consult, in order to guide the treatment efforts in the cities. Besides, we also have worked out this pairing assistance mechanism so as to make sure that each other province will be paired up with one of the cities so as to improve the treatment capacity in the localities. 4, improve the capacity of online consult. We have arranged experts from Tongji Hospital, the Union Hospital, and Zhongnan Hospital to conduct 24-hour online consult for the severe cases. 5, to move the treatment time period forward and strengthen the capacity at the quarantine locations as well as the temporary hospitals. Make sure that TCM is used to treat mild cases and prevent it from deteriorating. Currently, in our province, there are still more than 6,500 severe and critical cases that are receiving treatment in hospital, which means that we are still facing mounting pressure ahead of us. And we cannot relax for one moment. Coming up, we should learn from the past lessons and focus on the work in the following aspects. First, strengthen the 4 collective mechanism and optimize the treatment plan. Treat the patient with individualized plan and reduce fatality rate. Second, conduct early treatment of the mild cases. Implement the 4 early measures. Strengthen the treatment at the community level in temporary hospitals and quarantine spot so as to make sure that the patient can receive intervention as early as possible so as to prevent the possibility of deterioration. Third, to coordinate medical resources and make the best use of all the medical resources and human resources, organize teams of experts to conduct the contracted management and treatment in different regions, and conduct the experts' inspection, consult, and special treatment of the severe cases. 4. To conduct a combined treatment plan of TCM and Western medicine, strengthen the utilization of ECMO and other high-end medical equipment, strengthen support of multiple organs, and the treatment of pre-existing conditions of the patient so as to reduce complications. We will try our best to improve recovery rate and reduce fatality rate. Currently, we are witnessing some positive signals. However, it has become more urgent for us to restore work and life for the residents. So what are our measures and plans in the next phase? You asked a very important question, and we are making coordinated efforts and plans in terms of this aspect. With a joint effort, we are seeing a lot of positive signals. And we see that a lot of cities report 0 cases in a consistent several days. But we cannot relax for one moment, and we must take the strictest measures and to specify the measures and make sure that all the measures are implemented. On the other hand, we must address the medical needs, the other medical needs of the people. According to the Central Party Committee's commission, in terms of the focus on key issues, strengthen coordination, give sector-specific guidance, apply different policies for different areas, we will also be coordinating with the relevant medical facilities to restore the medical services in other areas. This kind of region-specific guidance means that we have to categorize the regions into different risk levels. High-risk regions, such as the city of Wuhan, would still prioritize the treatment of COVID-19 to commit ourselves to this strategic foothold without swaying and relaxing. At the same time, we also need to make proper use of the current medical supplies and make endeavors to make sure of the other medical needs of our patients. We also have designated hospitals to treat non-COVID-19 patients. Especially those with critical cases with dialysis needs and pregnant women and children. We also have designated a group of key hospitals to be transformed into medical institutions that provide comprehensive medical services. Coming up, we will be making adjustment according to the latest status quo so as to make sure that the designated hospitals for COVID-19 can be transformed and restoring their usual medical functions and close down the temporary hospitals when it is appropriate the other cities will also be making their own plans according to their local conditions. For the low-risk regions, we'll continue to consolidate the preventive measures to control the incremental and treat the stock numbers of cases and fend off the risk of rebound. We must coordinate all possible medical resources so as to make sure that we have supplies to spare and to guard against clusters outbreak in the localities. At the same time, we must be setting up these clean hospitals and zones to restore the normal medical functions in the hospitals. We also ask that all the medical institutions carry out medical appointment and give long-term prescriptions for chronic diseases. The prescription time period can be extended to 12 to 14 weeks. This kind of long prescription mechanism can help us to reduce the necessary appointments in the hospitals so as to reduce the risk of cross-infection. We also encourage that the patients seek medical services online. So that these chronically ill patients can receive the medical help, medical assistance, both online and offline. In terms of online medical consult, we also are including the consultation fee into the medical insurance mechanism and the reimbursement mechanism. We also open up services to mail the drugs to the patients. We want to create a favorable condition for the prevention control of COVID-19. We'll also be making endeavors to create a favorable environment to restore the usual medical services. After the patients were discharged, and some of them will go back home, and some of them will be sent to quarantine spots for further observation. And what kind of factors should they be paying attention to? Thank you for the question. After discharging, the patients had to read the doctor's instructions carefully, take the needed medicine. Because of the low immunity system, they are vulnerable to other diseases. We suggest that after discharging, the patients conduct a self-quarantine of 14 days and monitor the health conditions closely, and make sure that if he's experiencing some discomfort, and he or she may seek doctor's advice as soon as possible. And other health advice including wash your hands frequently, carry out ventilation, and maintain a healthy diet, enough intake of protein, fruits and vegetables, and sleep at regular hours, and do not use your cell phone, watch TV for too long time. Maintain a healthy psychological condition and take proper physical exercises, Tai Chi, for example, but do not exhaust yourself. And during the first week of discharging and the second week, you need to do help us to do the follow-up. Last question. With Hubei Daily, currently, the public are very concerned with the condition of the medical workers, whether the measures are taken in this regard of protecting the medical workers. The medical workers are the frontline soldiers in fighting against this coronavirus. They have put themselves in harm's way to safeguard the security and health of the people. I'd like to take this opportunity to, on behalf of all the Hubei people, extend my sincere gratitude to all of the medical workers and their family members. Thank you for your hard work. On February the 17th, General Secretary Xi Jinping made important instructions pointing out that we have to attach importance to the protection, care of the medical workers. On the 22nd, the Central Steering Committee issued the guidelines on protecting and caring the medical workers. According to these instructions, we have also worked out a series of measures to safeguard the interests of the medical workers. First, to safeguard their physical and psychological health, improve working and resting conditions, arrange their shifts in a scientific manner, strengthen protection and medical consultation, psychological consultation, and make sure that we provide a good location for them to take a rest, and make sure that they have enough medical supplies. For those with difficulties at home, we will establish these parent assistance mechanisms. Second, to improve the treatment and reward that include temporary subsidies, and the improvement of their salary, and encourage them to establish specific insurance. 3, to establish a favorable working environment for them. 4th is to reward those who have made major contributions, including individuals and teams. I want to thank all of the speakers and all the journalists. That's all for today's press conference.